Our next form of petrissage is a technique called a wringing technique. Really good to reduce tension through soft tissues, good to separate different layers of tissue where you've got fascial adhesions, and a good sort of overall broad petrissage technique that can be used for a number of different applications. So in terms of technique, then we need to make sure we've got ourselves in a really good strong position where we've got a wide base and our back's nice and straight, so we're not compromising our posture, and we've got finger pads onto the medial side, so we're really lifting and pulling through tissues, and the lateral surface we're using the heel of our hand to really push through. So get a really nice low base using your quads and your glutes, and you're going to pull with your medial on the medial side and then push on through the lateral side. So towards the top of the stroke, you can see we're getting a really good stretching through the tissues. It's going to induce a fair bit of blood flow through the muscles as well. If you've got any localized ischemia, it's going to separate the superficial muscles, so rec fem, from the deeper tissues like vastus intermedius. And you can use that with a bit more speed for things like pre-event massage. You can do it really nice and slowly for post-event massage where you want to encourage a bit more lymphatic drainage and venous return. Or it's also quite a nice technique where you're just trying to break up deeper techniques or more painful techniques to give the patient a bit of a break, and also a bit of respite from those more deeper techniques. You can also make it a bit more specific for a target tissue. So in this case, vastus medialis, where we're targeting a particular muscle rather than doing it as a broad stroke over quads as a group.